Hi. So, Declan, you are a senior lecturer in chemistry and the academic director of admissions, and you've been here since 2004. That's 20 years. Wow, and you're still here. So tell me, Declan, what was the university like back then?
Well, it was very different to what it is now today. I arrived in Bahrain in 27th of September 2004, and at that time we had a small campus, a temporary campus in Sif. There were a very small number of staff members. There were only 3 academic staff teaching science at the time, or medicine. And our first intake of students was a total of 28 students in foundation year that year. So it was really, really different to what we have nowadays. Well, we've got over 1,300 students now. So back then, you definitely did get to know all the students on a first name basis. You were helping provide, I guess, some of the student life activities. I remember getting involved in the talent shows. Not that I have any talents really to speak of, but it was nice. It was a very small family type of atmosphere.
Yeah.
The students were all really engaged, and it was very, very different to what it is now. So Gufran, you joined in 2008. You're now the head of department and associate professor in family medicine.
Yeah.
Can you tell me a little bit about how clinical education has changed over the last number of years?
Yeah, so like you said, Declan, we started with a small number of students. We had around 36 students in the clinical area. And this number has increased gradually over the years. Now we have between 180 to 200 students in the clinical area. So we recruited more consultants, clinicians, clinical coordinators. We established a rigorous training program in the clinical areas. And all of this would not have happened without the strong relationships we have with the hospitals and health officials in Bahrain. And we continue to build on this relationship. So what about the medicine program, the program in medicine? How do you think it has evolved since you joined?
Oh, I think it's evolved quite a bit. So if I take a trip back down memory lane again to when we first started, we had a curriculum which was very focused on traditional approaches to medical education. There was a lot of lectures. In foundation year, we still had a lot of small group teaching. I think that is important for students coming in directly from school. And we also had a practical component. But over the years, what we've seen is that with the development of the TEP2 curriculum, we've moved more towards case-based and small group teaching. There's a lot of self-directed learning and group teaching, which is really good for the students. I think they are more engaged, they're getting a lot more feedback. Also in foundation year, just like in the TEP2 curriculum, we're moving a lot more towards continuous assessment. The students get a lot more assessment on their feedback, which is really good for them as well, because they can address any issues that they may have, any gaps in their learning, and that's a real benefit for them. So what do you think are the strengths in the undergraduate medical program?
So first of all, I think it's evolving nature to accommodate the recent advancement in medicine and to prepare students and doctors who are adaptable to new knowledge, future doctors who are adaptable to new knowledge. Second, I think it's international perspective. So our program is in line with the international standards of good professional practice. And third, I think our program the beauty about our program is that we look at the end product first. So we look at the graduate profile and we ask ourselves, what are the qualities that we want to see in our graduates? And then we design a curriculum that meets and matches this profile. So I think this is where the strength of the curriculum comes from. And if you look now, Declan, at the reputation of RCSI, and when you look at how RCSI is well placed and respected among the health and higher education communities here in Bahrain, it's a source of joy for all of us, especially those who joined from the beginning, like yourself and me. So in all of this, Declan, and with the advancement in technology and so on, how do you see the future of medical education?
I guess it's going to be a continued journey through an increase in case-based learning for the students. I also think actually, you know, most recently, a lot of the developments that have occurred with large language models in AI, I think that that's probably going to be integrated into, how would you say, expanding cases and increasing, how would you say, improving the variety of the cases that the students will encounter. So I think AI will definitely have a role to play.
I think so, actually. I think artificial intelligence is going to be a powerful tool, and it's going to be, it will provide, you know, the future and opportunities for medical education. And also, I think in the clinical side of things, we will be using more simulation and more online training and online learning activities. However, I think in all of this, there is one thing that will not change, which is the patient. The patients will always be the center of care and the center of medical education, despite all the technology, all the you know, AI and evolvement and technologies and so on.
Absolutely. I think as well, AI certainly has a role to play in simulation as well. I think that will be a very, very powerful tool to develop that over the coming years.
Yeah.
Oh, wow.
So let's look at our envelopes.
Wow. What is this?
Oh, wow. This is gorgeous. Yeah. Wow. So you want me to start, Declan?
Sure.
Yes, so this is one of the proudest moments of my life when my son graduated from here. He is an intern now, and he is, well, he completed his medical degree here at RCSI. And this is a family picture with his brother's father and sister. That was last year, graduation, and I was reading out the names, and it was a very sensational moment, the moment I read his name in the graduation and the conferring. So yeah, it's a beautiful picture. Thank you so much.
That was a great occasion.
It's amazing.
Yeah, that was lovely.
How about yours?
Yeah, this, well, I have fond memories of my grey or my black hair back then. I've aged quite a bit since then. This was this was taken during a promotional day that we had for a charity challenge that I was running. It was a 6-hour running race. So I would say I'm quite passionate about running and sport and health, fitness, and the idea of the charity challenge was to try to bring people's attention to risk factors towards various types of diseases and how physical activity can actually reduce your risk towards developing chronic diseases. So this was the first charity challenge that we did.
Do you remember when was that?
It was 2012, I think it was,
okay.
If I'm remembering correctly.
Yeah.
And the idea is that you will try to create a physical-based challenge on a sort of a yearly basis, try to encourage people to participate in it, and of course, draw attention to
Yeah.
the benefits of exercise and health, to health, and then also as well support local charities. So that year we were supporting Bahrain Mobility International, which is a local charity that help people with disabilities in Bahrain. And actually recently I was just at an event there yesterday, and they were in attendance there. And once again, it was an event trying to promote physical activity and draw attention to local charities as well.
Yeah, that's good.